Our presentation will explain how to measure one's flexibility. Flexibility is the functional capacity of the joints to move through a full range of motion. A flexibility assessment should be done on a specific joint, and there should be an adequate warm-up before. The Canadian trunk forward flexion test should be done with shoes removed. Soles of the feet should lay flat against the flexometer at the 26 centimeter mark, with the inner soles placed within 2 centimeters of the measuring scale. The participant should slowly reach forward with both hands held together, holding the position for 2 seconds. They must make sure that their hands are parallel and they do not lead with one hand. Fingertips can overlap and they should be in contact with the measuring portion. The tester should ensure that their knees stay extended but not pressed down. The score is the most distant point reached with the fingertips, and the best score of 2 trials should be taken. A pretest should be done where the participant should perform a short warm-up and include some stretches. A tip would be to assess the participant to get their best attempt. The participant should exhale and drop the head between the arms when reaching. The procedure for the YMCA sit and reach test is: a yardstick should be placed on the floor between the participant's legs with tape across the yardstick at a right angle to the 15-inch mark. The participant should extend their legs at a right angle to the taped line on the floor. Their heels should touch the end of the tape and be 10 to 12 inches apart. They should then slowly reach forward with both hands held together, holding this position for 2 seconds. They must make sure that they keep their hands parallel and that they don't lead with one hand. Fingertips can overlap and they should be in contact with the measuring portion. The tester should ensure that their knees stay extended but not pressed down. The score is taken by the most distant point reached with the fingertips, and like the Canadian flexion test, you take the best of 2 trials. This is Lauren doing the YMCA sit and reach test. Proprioceptive neuromuscular facilitation technique is a specific technique used to increase flexibility, strength, and range of motion by targeting a certain muscle group with both stretching and contracting. Conditioning exercises should always precede PNF to avoid damage to soft tissues. The technique involves extending a certain muscle group until a stretch is felt, and then contracting maximally for 5 seconds against resistance. The muscle is then relaxed and the person carefully stretches the muscle beyond its normal range and holds for 30 seconds. This is followed by 30 seconds of relaxation before repeating the procedure, which is usually repeated 4 times. This is Lauren and I doing PNF. There are also 3 other types of PNF. Hold relax, which is an isometric contraction that is sustained and then the muscle is moved to its new range. Contract relax, where the muscle is placed in a maximally stretched position and resistance is applied to the muscle being contracted or the antagonist. And then there's also contract relax, antagonist contract. The muscle being stretched isometrically is contracted for 3 to 6 seconds, and then the antagonist will contract for 3 to 6 seconds, in which the joint can be pushed to its new range afterwards.